My name is Ushi Beregovich. I'm a licensed social worker, a New York State licensed social worker. I work for Family and Children's Association. I'm an individualized care coordinator, and I work with children between the ages of 5 and 18 with mental illness diagnosis. And I worked with adults 18 and over, all the way up to, like 70s, with severe mental illness. They've all had interactions with the law enforcement, whether it's when they were younger or when they were older. Their diagnoses were schizophrenia, bipolar, schizoaffective, which is schizophrenia and bipolar together in one diagnosis, borderline personality disorder, deep depression, anxiety, paranormal schizophrenia, because schizophrenia is like this huge umbrella, and it has different things that are entailed in it. That they're crazy. And a lot of them are not crazy. A lot of adults with mental illness, it's developed when they were young, whether it is family issues or traumatic experiences that the parent did not understand how to treat the child. So growing up, they always carried it with them. And because they were never treated, it got worse and worse when as they're, mature in age. Yes, because law enforcement think that, because especially with diagnosis like schizophrenia, when you're having hallucinations and delusions, that they are violent. So a lot of the times when you have schizophrenia and a family member were to call 911 for help, for example, they would come and assess the situation. But sometimes these mentally ill patients that just need your support and help are being put in handcuffs. When they were calling the police will come, assess the situation, cuff, whoever that's going to the hospital. Because most of the time when the family member is calling the police, the patient is no longer voluntary going to the hospital, because it's already to an extent where the family member cannot physically bring them themselves. So when the police comes, and if the person's acting a little bit more erratic than they normally would, they feel like for the police officer's own safety, they put them in handcuffs. But then that becomes another problem, because now you're taking them out of their home in the neighborhood that they've grown up in handcuffs. And neighbors don't know why this person's in handcuffs. They don't know that it's a mental illness issue. They think that you're getting arrested. It's an emotionally disturbed person. So at that moment, they don't know what your mental illness diagnosis is. But as part of having a mental illness is you're emotionally disturbed, meaning there's something going on in your brain, and the waves of your brain that are not as leveled, as how our brain would be leveled. If they're being violent, I do believe that, officer safety comes first at the end of the day. So if there is a person that you're trying to help and assist in whatever services to provide or bring them to the hospital, and if they're punching you in the face, I think they should be handcuffed. No, they're not. Their violence comes from them being scared, their anxiety level when they see a police officer, because they don't know what's going to happen to them, how they're going to be treated, how the public is going to view them, and what's going to happen once they arrive to the hospital. So normally when a police officer brings a child or an adult to the hospital for psychiatric reasons, they're normally at the hospital 4 to 5 days, and that could be very scary for some people. I think it would benefit the law enforcement to be trained more on different diagnoses, and that when they are going to escort someone to the hospital, they ask what is the mental illness diagnosis, so this way they know if the person is going to be violent or not. 90% of the time the person's violent to themselves, not to others. They're not crazy. Please do not treat them like they're crazy. They might not be in the right state of mind when you see them, but on a regular basis, they're normal, and they're a human being just like all of us. I tell my clients there's no such thing as normal or crazy. Some of us just hide our craziness a little bit better than others.